Thanks for everybody for coming to the meeting. I just want to start out with some patient voices. We had a couple compliments. First one, she was very impressed with the care that was received by all of the care team members, mostly including the rooming nurse. I believe her name was Paige.
Great.
Good job.
Good work.
She did an outstanding job and very, very impressed with the care that was provided at her visit. Then I just want to move into reviewing some quality measures. First off, our mammogram rates are at goal, so you guys are doing an excellent job with that. One quality measure that can be worked on, the colonoscopies are down a bit.
Colonoscopies down. You guys are always scheduling colonoscopies. Well, anyway, why don't we take a look at the drill down this afternoon if you guys had a chance. Let's see who's on a list and maybe we can give some calls and get that turned around.
Okay, we'll work it in.
Sounds good.
As you know, with our new workflow, we've been contacting patients whose hemoglobin A1C is over 9. I'm working on that list, trying to reach out to patients to get them in and be seen and get their labs for you, okay? And did you have anybody that you have on the work list that you've been reaching out to? And then the CCMs, I'm working on those lists to try to reach out to those. Corey, do you have anybody that you're seeing that would be eligible for CCM coming up soon? Next, I wanted to talk about a patient, Dr. Jerzyk, you mentioned to me about someone you had seen that would be good for the extended care team.
Yeah, it's Leah, and I actually saw this guy today. We had seen him only a couple times previously. I didn't know him very well. He's a 54-year-old guy, Joe, and he's sort of in some trouble now. He has a history of bipolar, and he stopped his meds. His diabetes is under control. He's got hypertension that's not controlled. We really don't know what meds he's on. He wasn't really clear on what he's taking. So it was sort of a mess, and we sort of thought we'd bring him up and see what you guys could offer today. Now, luckily, Dan was able to see him right after our visit, so we did a warm handoff to Dan, and about his mental health issues. And what did you come up with when you talked to him?
Absolutely. So yeah, I got to meet with him the first time today as well. And clearly pretty overwhelmed. He's got a lot on his plate, and it sounds like there's some history of him going off of medications before, so this isn't the first time. He was a little hesitant about counseling, but he's willing to come back and meet with me again. So I'm going to meet with him again next week, and we'll do some more education on bipolar and the importance of medications. Yeah. And I think getting him connected with our psychiatrist will be really good too. So I'll put in an urgent request for that. But I think he'll need a lot of support. So any support we can give him, he just feels pretty overwhelmed by everything right now. So.
Okay. And did I mention, Beth, he had no insurance?
Right, okay, so if he...
And lost his job on top of it.
Okay, so if he lost his job and lost his insurance, I can call him. If he has no income right now, he probably would be eligible for Badger Care, so I can hook him up with this company that Bellin uses called HRS Erase. And they can call him, and they do the Badger Care application over the phone. So all he'll need to do, he won't need to go online or anything. All he'll need to do is answer all their questions. Sometimes we can get Badger Care to backdate, so we can get his visit with you that he had today covered.
I think just looking at all the things that you're telling us that he's struggling with, he's probably going to need all of the extended care team members involved. So if it would be okay with everybody, I think I'll go out and do a home visit. During that time, I can sit down with him, go through his medications, do a pretty thorough medication reconciliation with him. Depending on what we find out, I think it would be good to put referrals into both diabetes and pharmacy at the time of the home visit. And if he's agreeable, I'll get him scheduled with both of you guys right away. It would probably be a good idea to do your visit in conjunction just with those, his chronic kidney disease issues with the diabetes. Yeah. What do you think about that?
That'd be perfect. Let's do that. Yeah.
So what do you guys, does that work for you guys if I go see him first?
Yeah, I think that would be great because then you can queue up the meds, understand exactly what he's taking. If there's anything that you detect in the home that he shouldn't be taking, even just educating on that medication-wise, and then do kind of a handoff to Anne.
Yes, and after you see him, Katie, then I could see him and kind of go over diet. I think he might have some trouble trying to figure out what to eat for the diabetes and the blood pressure and the change in kidney function.
And then I just want to touch base to talk about any recent patients that you guys are working on. Beth, would you be able to start us out?
Yep, so I'm going to start with Virginia. So you put a referral into case management for Virginia. Okay. I did review her advance directive, and it is all up to date and scanned in our record, so that's good. And I'll be following up with her in a couple of weeks to see how she's doing.
Perfect. Do you met with her husband too?
How about you, Corey?
Yeah, I just wanted to touch base on Jack. So Jack's fairly complicated. He recently his CHF has been a little bit more uncontrolled. I also send in a referral to Katie for his diabetes. He is on mealtime insulin and nighttime insulin, and it's just a very complicated regimen for him. So I'm going to have her take a peek to see if there's any way that we can simplify that to help him become a little bit more adherent to what we're asking him to do.
How about you, Katie?
Yes, I just wanted to talk about Arlene. So I just met with Arlene in the last week, and she has COPD.
Probably if she was high for blood pressure, we should make sure somebody does a follow-up within a month.
Okay, I will jot that down.
Probably with the RN would be a good idea.
Okay, I will have her meet with you
Perfect,
then
yes,
in
that'd
about
be
a
perfect.
month. I will route you my note as soon as
Okay.
I'm done with that as a reminder. I did start to have a discussion with her. Her anxiety levels have been higher lately. She is on paroxetine. We had a discussion about potentially meeting with you, Dan, but if she'd be willing to meet with you first, I think that would be the route to go.
Good.
That sounds really good, and maybe I can even join in on one of your appointments and just meet her in person.
I think
That might
would
be
a
helpful.
really good idea. Yeah,
Okay.
Good. Anything else that you have, Katie?
that's all.
Okay. How about you, Ann?
Yes, I'm working with John, and John's been doing a 70-30, a Novolog 70-30 insulin at breakfast and at supper.
And how about you, Dan?
Yeah, so I just had one update with Lexi. Remember, she's 17 and was missing a lot of school due to some panic and anxiety. So we started that sertraline. She's feeling a little bit tired from it, so we switched it to nighttime.
Okay.
But did a good job. Just we're learning some coping skills for that, some calming skills, and she's been going back to school.
Did you have anything else at all, Dan?
No.
Okay. Well, I think that was great. Thanks for all your input, and then we'll follow up in about a month.